Welcome to the nursing tricks. Basics are the basics and you can't skip the basics. To discuss about memory based questions, first is which is not National Vector Borne Disease Control Program? Answer is plague. Second is the endemic disease that occurs every 4 hours of interval is called cyclic trend. थर्ड इज वैक्सीन इज मोस्ट फ्रीज सेंसिटिव वैक्सीन फ्रीज सेंसिटिव वैक्सीन पूछा है, इसका आंसर है टीटी is tetanus toxide. Fourth is which measures is used for growth monitoring and center is weight for age. Fifth is which site is responsible for sciatic injury? It's dorsogluteal. Sixth is iron and folic acid used in antenatal women. It's 60 mg iron and 500 mcg folic acid. Seventh is World Patient Safety Day was celebrated on. Answer is 17 September. Eighth is primary prevention for cervical cancer. It's HPV vaccine. Ninth is National Nutrition Center. It's Hyderabad. 10th is vitamin D deficiency in children by rickets. Rickets in children caused by vitamin D deficiency. 12th is night blindness is due to which vitamin? Vitamin A. Which vaccine is kept in freezer compartment of refrigerator? It's measles. 14th is the disease caused by the red flu. Endemic typhus is also known as marine typhus. Next question is 15. Screening of depression at community level is an example of its secondary prevention. Next, 16. A study was done to identify the number of typhus cases due to exposure from a common village in the groups was formed of calories and diseased people. What design is represented here? Case and control study. Then ET formula. In children's, uncuffed ET plus age in years upon 4 plus 4. Then 18 is cold and clammy skin over the cannula area. The next is CVP line having phlebitis. Carpopedal spasm, which drug given? It's calcium gluconate. Next is rule of 9 having total back and arms as burn. Then which percentage having burn? It's 27 percentage. Next is a woman having 10 weeks pregnancy and having earlier having 2 childs, which is 6 weeks and 39 weeks at birth, and having what is the ratio of GTPL? The GTPL ratio is 3 to 102. Next is which nerve is damaged by radial mastectomy? It's axillary nerve. Next is which vitamin given during Wernicke-Korsakoff's in alcoholic patients? It's thiamine. Then mismatch the following. Having answer is alcohol dependence, baclofen. Albuterol and meclomethosone puffed in a respiratory patients. First given albuterol puffed, then beclomethasone. Next is potassium correction in patient, which is incorrect. It's potassium chloride IV bolus. The next question is a required dose of KCl is 20 milliequivalent. Available dose is 30 mEq in 15 ml. How much ml is given? Dose and upon available dose into 15 is the answer is 10 ml. Then comes is 23 number surgical blade. Peak level of regular insulin is answer is 12 noon. A trachomatis vaginalis images are shown. A harmonic scalpel image have seen. Next is potassium rich having potatoes. Then what is the year of copper T? 380A. Duration is 10 year. In chronic kidney disease after dialysis, which measures occurs? It's weight loss. NG2 measurement is by next method, nose to earlobe and to xiphoid process. Next is after surgery replacement of NG is pH is aspirate 3.5. Chest compression in newborn in resuscitation is 3:1 in newborn resuscitation, which is 90 compressions and 30 breaths. Complication of liver biopsy which is bleeding. Adrenaline dose in children, it's 1 ratio 10,000, it's 0.1 ml IV. Next is blood Parker Handle. Next is Foley's catheter image. Next is LNG image. Next is Joel's retractor image. Next is when the nitroglycerin is placed in mouth. Answer is stinging and pain over chest. Next is cause of delirium is multiple medication. Next is all of these river of Punjab except it's Ravi in this number, which is next number. Answer is 21. Next is most indicative side of fecal impaction. This is all about memory based questions. Thanks for watching.